That's one of the most surprising findings to have emerged over the last 10 years, that really mom seems to know best in terms of deciding, is this looking like a mood disorder, or is this looking like something else? And that isn't what I was taught, and that isn't what most of us expect as clinicians. But one very important thing to realize is that there are two kinds of symptoms in the world. In the words of Danny Cantwell and Gay Carlson, there are onion symptoms and garlic symptoms. Onion symptoms would bug us if we're having them. Garlic symptoms bug everyone around us when we're having them. And the symptoms of mania are really a bunch of garlic symptoms. When a person has lots of ideas coming and they're trying to talk really fast and they get pressured speech, they don't think that they're talking too much. And they don't realize the impact that their behavior is having on other people. What we see when we give the family questionnaires to fill out, and we ask the parent, has your child been seeming more irritable? They're like, oh yeah. And then we ask the teenager the exact same question. They say, no, stupid question. And they answer no on the instrument. For us as clinicians, we have a couple other options. We can pay attention to the nonverbal behavior. No. Well, your mouth is saying no, but your nonverbals are definitely... Or we can put ourselves in their shoes. And so I've started asking questions like, since you've been sleeping less and really feeling like energetic, have you noticed that mom has been arguing with you more? Have you been getting into more arguments with teachers at school? Do you feel like you're surrounded by idiots? Because that's what their personal experience is like. It's not that they're more irritable, it's that everyone around them is being an idiot. The other thing which we're learning is that, as clinicians have seen for a long time, mania and hypomania often feel good to the person who's experiencing them. People have talked about the seductiveness of hypomania and getting caught up in it, and so they don't feel ill, and it's exactly as they're getting pulled into it that their insight goes down, and they notice less and less the nonverbal cues and the effects that it's having on other people. So the parent report, having a concerned adult, or if we were working with adult patients, a spouse or a roommate, someone else who is there and has seen the changes in behavior, notices the garlic symptoms, can be a huge help in terms of really building the case in favor of this being a mood disorder.